Okay, so hello everyone. Today we are going to start with oral pathologies important syndromes. Part 1. There will be another part of this video which contains other important syndromes apart from this one. So let's get started. It is very important for NEET, PG and INI both of the exams. And here we are going to keep pictorial images so it will be easy for you to learn the syndromes. So first is Pere-Romberg syndrome. Pere-Romberg syndrome. In this syndrome, there is a progressive hemifacial atrophy is seen. One side of the face wastes away. See, as you can see here, this is the one side of the face wastes away. See, this side is a normal side, but this side is wasted. So, this is known as hemifacial atrophy. Okay, coupe de sabre, like sword like scar is seen. See, you can see this scar. This is known as coupe de sabre. This is a very important point of Pere-Romberg syndrome. Coupe de sabre is also present in other diseases like scleroderma. Coupe de sabre means linear line, as we can see here. Now next, Van der Waals syndrome. What is Van der Waals syndrome? Lip pits are seen on the lower lip. This is known as Van der Waals syndrome. It is associated with cleft palate or cleft lip or both. This is known as Van der Waals syndrome. See, these are the only important points which you have to remember for the examinations. Not much more is required. Next is Usher's syndrome. Usher's syndrome has blepharochalasis, non-toxic thyroid enlargement and double lip. The characteristic is double lip. See, you can see here. Double lip is seen. Blepharochalasis and non-toxic thyroid enlargement. So, what is blepharochalasis? Blepharochalasis means edema of the upper eyelid. See, as you can see here, this is edema is seen on the upper eyelid. This is a characteristic and this is also the characteristic, very important one which you have to remember. Next is Melkersson-Rosenthal syndrome. This syndrome affects the facial nerve majorly and it has a triad. It has a triad of cheilitis granulomatosa. See, you can see here on the tongue. Facial paralysis because it is associated with facial nerve, and fissured tongue or scrotal tongue is seen. This is a very important syndrome. It is asked many a times and you have to learn this triad thoroughly. That is cheilitis granulomatous, facial paralysis and fissured tongue. Next is Peutz-Jeghers syndrome. Peutz-Jeghers syndrome is associated with SKT11 gene. It is asked many a time, so you have to learn this. In this syndrome, pigmentation of face, oral cavity and hands is seen. See, you can see here many pigments are seen on the face, oral cavity and hands. Multiple intestinal polyposis are also seen. This is a characteristic sign along with pigmentation which occurs in Peutz-Jeghers syndrome. Then next is Rubinstein-Tayeb syndrome. Rubinstein-Tayeb syndrome is also a very important syndrome to remember, and in this syndrome developmental retardation is seen, broad thumbs are seen. So you can see here greater toes, delayed and incomplete descent of testes. But main point for us to remember in for dental examinations is talons cusp. This is a very important point to remember. Talons cusp are always seen in Rubinstein-Tayeb syndrome. See, this is the extra cusp which are present on the behind the incisors is known as talons cusp. Talon means an eagle's talon or a panja. We say it panja, eagle's panja, that is. The next is Klinefelter syndrome. This is very important. It is 47XXY syndrome, also known as 47XXY, because of an extra X chromosome, which leads to female like characteristics of a male person because of an extra X chromosome, which leads some of the signs are poor beard growth, then breast development is seen, underdeveloped testes. But for us, the important thing in dentistry is taurodontism. This is very important. Taurodontism means enlarged pulp chambers are seen in the teeth. This is known as taurodontism. This is also a very important syndrome. Next is Gardner syndrome. In this syndrome, we can see osteomas, adrenal gland tumors, polyps in stomach of intestine, desmoid tumors, epithelial cyst, supernumerary teeth, and CHRPE of retina. But for main point for us is supernumerary teeth are present in Gardner syndrome. This is also an important syndrome to learn. Next is Eagle syndrome. In Eagle syndrome, elongation of styloid process is seen. See, you can see here, this is the elongation of the styloid process. Also leads to stylohyoid ligament calcification. The ligament which is attached to the hyoid bone, to the styloid, to the hyoid process down there, which calcifies. And what happens? Dysphagia happens. Pain also occurs, but by closing the mouth, the pain relieves or the pain goes away. Then sore throat, otalgia, that is a pain in the ears, glossodynia. All of these are the signs of Eagle syndrome. It is also a very important syndrome. So let's revise all the syndromes again. First is Perry-Romberg syndrome, which leads to hemifacial atrophy. At one side of the face wastes away, and we see coupe de Sebre sign, that is a linear line is seen, swart scar is seen on the one side of the face. Next is van der Waals syndrome. Here lip pits are seen on the lower lip, which is also associated with cleft palate or lip, or both. Then Usher syndrome. Here we see blepharocheliasis, means edema of the upper eyelid. Then double lip, which is a characteristic point, and non-toxic thyroid enlargement. Next is the Melkersson-Rosenthal syndrome, which has a classical triad of cheilitis granulomatosa, facial paralysis, and fissured tongue or scrotal tongue. Next is Peutz-Jeghers syndrome, which is related with SKT11 gene. It shows pigmentation on the face, oral cavity, and hands, and also multiple intestinal polyposis are seen. Next is Rubinstein-Tayebbi syndrome. Here, the main point for us is Talon's cusp, which is seen behind the incisors. Next is Klinefelter syndrome. Here the important point is taurodontism, means enlarged pulp chambers are seen in the teeth, which occurs in Klinefelter syndrome, 47XXY syndrome. Then Gardner syndrome. Here the main point to remember is supernumerary teeth or various teeth are present. Here also it is seen that OKCs are associated. Multiple OKCs are associated with this syndrome. Then Eagle syndrome. Here the important point is elongation of the styloid process and calcification of the stylohyoid ligament, which leads to dysphagia, sore throat, otalgia, and glossodynia. Then Fraze syndrome. Fraze syndrome is sweating and flushing of a patch of skin near the ears occur due to eating. Sorry, I forgot this one. What is Fraze syndrome? Fraze syndrome means sweating and flushing of a patch of a skin. See, you can see here the skin, which leads to sweating When it occurs, the main point is it occurs during eating. Sweating and flushing during eating near the ear. Okay, why does it occur? It occurs due to damage in the auriculotemporal nerve. Which how does it happen? It can happen due to any surgical procedure, prior lidenoid injury to the parotid gland. So this is Fraze syndrome. So here we end with our syndromes part 1. Stay tuned for the part 2. Thank you very much.